So if you joined us today to hear about empowering your child's care provider to provide the best quality of care for your loved one with Rett syndrome, with Dr. Tim Benke from Colorado Children's Hospital, Katie Hale, nurse practitioner from Katie's Clinic at UCSF Children's Hospital, and Melissa Kennedy, executive director at rettsyndrome.org, you've arrived at the right place. This is Paige Nuez. I'm director of family empowerment at rettsyndrome.org. And our board of directors and all of us at rettsyndrome.org want to thank you for being with us today and for all of your support and your engagement. Continuous awareness and empowerment is critical to our shared success. And I say this both as a parent to a beautiful teenager with Rett syndrome and as your advocate at rettsyndrome.org. We want to thank you for joining us. We want you to be as educated and empowered as possible as you care for your child and as you speak to others about Rett syndrome. You can count on us at rettsyndrome.org to bring you the latest news and information and to continuously push for new and innovative findings. Today, we're going to unpack the Rett syndrome primary care guidelines. You'll learn how to use this evidence-based tool to partner with your child's physician, or as a physician to partner with your patient family, and use the guidelines to provide suggested visits, schedules by clinical area of assessment, specific concerns to look for, and timelines for follow-up. So we welcome you, we thank you. We have a few short updates for you before we begin. So at rettsyndrome.org, we believe that all information on our rare disorder should be free to all who avail themselves of it. And we want to thank our donors and supporters for the shared belief. Especially, we want to thank Acadia Pharmaceuticals for their 2021 educational programming support. Next, I'd like to say that we are very excited and gearing up for the Ascend 2022 Rett Syndrome National Summit in Nashville. Designed to unite us as a community, this event will bring together parents, families, clinicians, researchers, and Rett organizations from around the world. Together, we can overcome the challenges of Rett syndrome and reach the summit of hope and healing and a world without Rett syndrome. So please save the date. We're very excited to be in person with you again, April 27th through 30th, 2022 in Nashville. Now, as you know from past Rett Eds and from visiting our website and having access to our newsletters, you're familiar now with our Rett Research Ready tool. It's an online tool here to help you find information and help you be Rett Research Ready. You can find all the information on clinical drug trials, but we also want to point out these 3 studies that are seeking participation that do not require you to trial any drugs. If you scan the QR code on this slide, it will take you right to this page and you can check out these 3 studies, and we hope you find one for you. Next, I just wanted to make a quick research update. Yesterday, Novartis Gene Therapies, formerly AveXis, made an announcement that they are seeking to submit an investigational new drug application to the FDA by the end of 2021. We're always getting questions about the status of Novartis and where they are with their studies. So we wanted to share this news with you today, and you can find more information on our website and our social media pages. We're very excited to partner with this organization, and we're very excited when the day for gene therapy trials become a reality in Rett syndrome. Okay. Last update, we have a few upcoming webcasts. You can find registration on our website. March 9th, we'll be talking to some real-world people who have taken the communication guidelines and applied them in their community, both SLPs and parents who have utilized the communication guidelines since we published, and that conversation will be facilitated by co-author Teresa Bartolotta. So if you have the communication guidelines and have kind of let it sit off to the side before getting started with it, join us on March 9th, and hopefully that will kickstart you getting that into your home and into practice. April 13th, we're going to have a special Rett Ed called Let's Hear It for the Boys, Males with MECP2 Mutations, with Dr. Bernard Suter from Texas Children's. And later in April, we will also have a Rett Ed on part 2, What Hurts. We did a Rett Ed on what hurts pain research in in the fall of 2020, and we had a lot of questions on pharmaceutical interventions, treatment, and management of pain. So we're excited to bring this part to. Again, thanks for joining us, and you can pre-register for all of these sessions on our website. As promised, if you signed up for today's Rett Ed webcast and you gave us your address and you live in the US, we are happy to send you a color print copy of the primary care guidelines. So it'll take us a couple of weeks to get those in the mail and get them to your home, but you can expect them. Your guidelines are on their way. If you did not give us your address, you can look and you can see that attached to today's webcast, we have 4 documents. One are the digital version of the primary care guidelines, which you can find on our website. We also have the 2 articles that were published on consensus care that Dr. Benke is going to talk to us about a little bit later today. And you can find a harmonized reference guide. A lot of physicians and clinicians and researchers have asked for access to all of the papers that were rolled up into creating these guidelines and the articles, and we've harmonized that list, and that is the 4th attachment. If you have any trouble downloading those, just send me an email at pnuez@rettsyndrome.org, and I'll be happy to get them over to you, and we also have them on our website. Okay, thank you for giving me some time to share those updates from our organization. We're working really hard for you in 2021, and we hope you're as excited as we are with all the information we have. But now I'd like to turn the microphone or the stage over to Melissa Kennedy, Executive Director at rettsyndrome.org, who's going to give us some background as to why we think the primary care guidelines are so important to our community. Thanks, Melissa.
Thanks, Paige. It's great to be here. And as you said, I just wanted to briefly talk about why this work that you're going to learn about today is really so important and is, I think, a priority for our foundation to support. So our mission at rettsyndrome.org is to transform the lives of individuals living with Rett syndrome by investing in groundbreaking research that's really aimed at bringing life-changing therapies to you and your family via your physician's prescription pad, ultimately. At the same time, we're actively working to support the development of a high-functioning clinical network that is made up of healthcare providers who are participating and are part of the Rett Syndrome Centers of Excellence, but working in combination with an informed and educated network of primary care providers. And when I say that, I mean both pediatricians as well as adult providers. This network ultimately needs to work in partnership with caregivers who understand what care their loved ones with Rett syndrome needs. This partnership is going to allow us to be confident that we're going to achieve our goal of making sure that every person living with Rett syndrome is receiving care that is consistent with evidence-based clinical guidelines. That's really critical. This is challenging work, but it's also extremely important work. It requires our foundation to support both the development of clinical guidelines, and that's what Dr. Benke and Katie are going to be talking with you about today, as well as sharing and spreading those guidelines so that they're widely available. Our commitment to you is to continue to work with our medical advisory board to keep the guidelines regularly updated. This is something that needs to happen every year or so, or 2 years or so, and to work with national organizations, professional associations, professional societies, using anything at our disposal to get these guidelines broadly distributed and broadly adopted. And today's discussion is the first of many ways that we're going to do this. Paige, if you could go to the next slide that talks about our medical advisory board. You see a list of individuals there who are Rett syndrome experts, and I just want to thank them. Every one of those members works evenings and weekends when they're not taking care of patients to help us to create the criteria for Rett Syndrome Centers of Excellence, as well as keeping our guidelines updated. It's our honor to work with them as we serve families living with Rett syndrome. And with that having been said, I would like to introduce Dr. Benke and welcome him to the floor. He is our medical advisor, as well as one of the authors of the guidelines that you're going to be talking about today at one of the articles that was recently published. So with that having been said, Dr. Benke, it's all yours.
Thank you, Melissa. Thank you, Paige. And thanks everybody for taking time to listen to what we have to say about the guidelines and how they came about. Next slide, please. So we sought about to develop consensus-based Rett syndrome guidelines, and the overall goal was to improve the quality of care that all individuals with Rett syndrome receive. And our methods were to use expert opinion and consensus methods, which were informed by available evidence to create a comprehensive guideline. And when I say available evidence, there aren't any trials where they would say, you know, if you do this, does this happen? There are a few very limited trials in that regard, but we used the available evidence that was there to create these comprehensive guidelines. One of the questions that came up on the web was, did we compare it to other guidelines? And the answer is yes, we did. And our approach was to provide something that was unique and clinically applicable to our patients and families. But what we also wanted to do was to put it in a format that was understandable by our primary care providers. And so we often followed some of the guidelines that are put out by the American Academy of Pediatrics so that it looked familiar to people. This is based on evidence for Rett syndrome, but we think that what we've put out is something that's generalizable, that is useful to other MECP2 and other similar disorders, including CDKL5 deficiency disorder. Next bullet, please. So the history was Dr. Mary Jones, the late Mary Jones, and Katie's going to say a few words about that, and Katie Hale and Paige Newis at the UCSF Benke Children's Hospital started a set of guidelines. And essentially, the NIH-funded natural history study team took these on and developed a group method to refine them and turn them into something that was published. And these were published in July of 2020. Next slide, please. So why we created these guidelines. So our primary goal was we want to empower primary care providers. This is pediatricians, family doctors, internists, to be lead members of the care team. Next bullet, please. One of the issues is that we know that only 45% of individuals across the US are cared for at a specialized Rett clinical center. So therefore, it's happening by primary care providers, and we wanted to work with them to provide them a useful set of guidelines. Next bullet, please. Our feedback often is from families is that they often know more about Rett syndrome than their medical providers. They often find themselves explaining things to any number of people whenever their child is or individual is seen. Next bullet, please. Since most individuals seek care via a primary care provider, they should have an understanding that primary care providers should have an understanding of how Rett affects the individual and their family. Next bullet. And most importantly, care does not end at 18 to 21 years of age. And so we wanted to have something that was useful across the lifespan. And so we've organized that specifically in the papers that are published so that it's clear that this is a progression and not something that's limited to pediatricians. Next bullet, please. Our goal is we want to maximize the potential of individuals through being as healthy and as possible. Next slide, please. So these are the two publications that came out, and one of the most important things on this slide is that there is an army of people that came together to put this together. It wasn't just Mary or Katie or myself. Carrie Fu at Vanderbilt, as the lead author on these, put a lot of effort into herd these cats all together to get these consensus guidelines put together. And these represent clinicians across the country. It also represents patient advisory groups, RSO as well as RSRT. And So it was a broad group of people that came together to put these consensus guidelines together. And these are the two, if you click on these links, you'll go straight to these papers so that you can download them. They're ready to download along with any of the supplementary material that's there. Next slide, please. So now I'd like to introduce Katie Hale at UCSF Benioff Children's Hospital, associated with Rett syndrome and related disorders program, and she's going to walk you through how the guidelines work.
I just wanted to thank Tim very much for the introduction, and for Melissa and Paige also. Again, my name is Katie. I'm a pediatric nurse practitioner at Katie's Clinic for Rett syndrome and other related disorders at UCSF Children's Hospital Oakland. I am not the Katie that the clinic was named after, but I'm lucky to be on her care team. So I just want to start off my portion of the presentation with a very special picture to me. This is a picture of me and Dr. Mary Jones, who, as Tim mentioned, passed away in November. And she was just an incredible doctor and an incredible person. And she taught me everything I know about Rett. And this is she and I sort of taking care of one of our boys with MECP2 duplication. And she was truly dedicated to making sure that our patients got the care that they deserved. And I just know that she would be absolutely thrilled to know that we're here presenting these today with you. One thing that Mary and I both share in common is that we actually come from a background of primary care. Mary was a pediatrician in the community before she dedicated herself to Rett, and I, before Mary's passing, actually also worked as a primary care pediatric nurse practitioner at a busy clinic in Berkeley, California. So, excuse me. So that experience really was helpful when we were trying to shape these guidelines to make sure that they were useful for the primary care practitioner. And again, just sort of voicing again what Tim, said, is that we wrote these guidelines really to ensure that the medical needs of the individual were met. That they're not in pain and that they're learning and living in an environment that really allows them, again, to reach their full potential. That's the most, the important thing. That's what we're striving for. And during my presentation, there's going to be times when I'm focusing my thoughts on providers, but also speaking directly to the families who are listening. And really, we're all on the same team. So that information is important for both parties. And so just some general rules when evaluating or examining a child or an individual with Rett syndrome. Individuals should be, they should be seen by their primary care provider for regular wellness checkups, immunizations, and sick visits, sort of as needed. And if you haven't been able to see the guidelines or the recommendations for the COVID vaccination that recently came out, I really recommend that you take a look at that, because it's helpful to understand that the Medical Advisory Board for RettSyndrome.org is supporting COVID vaccination for individuals and for caregivers. So again, regular wellness checkups, immunizations, sick visits, important. And so when you are examining a patient with Rett syndrome, you really want to make sure that you're looking at them fully. If you're taking off their braces, you're taking off their shoes, their outer clothing, that's important. And extra time and space is needed for this. This is especially important for those checkups. And we also recommend that parents and caregivers keep a binder of health records, that includes as much information as possible. Excuse me. In theory, all of this medical information is kept in the cloud, in electronic medical records in institutions, but better safe than sorry, as much information as you can keep. These are some examples, as you can see. Genetic testing results, really important, and really a key piece to enroll in some of these drug trials that we're seeing coming up. And this can also be helpful for your primary care provider, having this information coming in with it, so you can share things with them if they're not easily able to access that information on their own. And so here are just a couple characteristics that I feel are important when we are discussing what you're looking for in a primary care provider. pretty straightforward. You know, being a good listener, right? You as a family, as a caregiver, you are an absolute expert in your child for sure. And it's really important that the primary care provider realize that and work with you. So when you're trying to figure out what's wrong with a child or an individual with Rett syndrome, really sort of not only examining them, but working with the family to get a history of what's going on is going to really help you zero in on what the concern is. So learning, again, crucial. And you may be the only person in this person's practice that they've seen with Rett syndrome, and I know many families have experienced this. So using these guidelines, being open to learn is important. And partner, again, this is a team effort. So partnering with you, partnering with the other specialists, with the education team, with therapists. The primary care role is to sort of synthesize all that information to see the big picture for you and make sure that nothing is being missed. And advocate, man, this is a big one, right? So making sure you're getting that wheelchair, making sure that we're getting the medicines that we need. And again, I don't want to say that we can sort of wave a magic wand and get everything, you know, the primary care can't get you everything you need right away, but sometimes a helpful phone call or a helpful letter can really assist in that. And so if, you know, when we sort of build this care team and a primary care provider who really knows, it's helpful because they will know, you know, they will know the baseline. Let me see if I can get rid of this little guy. It's not in the way here. So they'll know the patient's baseline, right? They'll know what's normal for your individual, right? And that's important. Sort of how do they present when they're not recovering or sick? And you know, a quick story about this is that we had a patient who was hospitalized for longer than she needed to be because her feet were sort of pale and chilly. And that was her normal, that was her baseline, but to the hospital provider, it was concerning and scary. So having a primary care that can sort of make that connection and say, hey, this is nothing to worry about. This is sort of, you know, this is what's normal. And so how to use this document. So again, targeted to really empower primary care providers and a reference for Rett specialists. Should also be given to specialty providers and therapists who are not familiar with Rett syndrome. And also can be used by caregivers to sort of track and understand the care that's recommended for their child. Again, sort of this big team effort. And this is a great thing to put in that health binder that I talked about. And so these are the guidelines that I know a lot of you are going to be sent. And this, again, sort of is what the basis of the publications that Dr. Benke was speaking about is. And it's you know, we really did our best to try and make it very clear and as succinct as possible. And, you know, it's a two-page table with also some additional pages to really flesh out our recommendations. And so how this table is organized. So, you know, in this red box, you're going to see the areas of assessment. So all of the areas of the body, the systems that are affected by Rett, in addition to topic areas that are important to address, like therapies, education, etc. And so in blue, we have the assessment details. So things to consider that pertain to, you know, the areas of assessment. And then when these things should be checked, yearly at checkups, every 6 months, you know, at the baseline or at every visit. And again, there, you know, sort of the following pages after the table really sort of flesh out those recommendations and give suggestions on how to manage some of the common things that we see with Rett syndrome. So I'm just going to go into just now kind of dig into the table and give you some of the most important points. And, you know, truly everything in this table, you know, in these documents are important, but these are just sort of the sort of heavy hitters in my eyes. And so measurements should be taken: weight, height, head circumference, the stage of puberty or the Tanner stage. You know, these are things that certainly need to be assessed at every yearly checkup. You know, head circumference is generally not something that's measured beyond 2 years in a traditional primary care pediatric practice, but if possible, continuing to measure that, we recommend. Weight, incredibly important. We know that patients with Rett syndrome have trouble maintaining their weight. So really, I recommend it even if you're just going for a rash, to have the weight taken to make sure that we're keeping on enough weight. And we know that sometimes signs of puberty, which I'll speak about later, can happen sooner. So it's important to also check for those things. So laboratory work or blood draws, right? I'm not going to go into all of them. This is sort of what we recommend, things that we should do yearly. And again, something that I recommend the family and the primary care provider to be very cognizant of, because it's helpful if we are getting a blood draw for some other reason, we can add these things on. So, hey, if we checked our vitamin D lately, let's tack that on so we don't have to poke our kids, we don't have to poke anybody unnecessarily. And a medication review, again, just crucial that every provider that sees your child knows what medications they're on, and please to include homeopathic remedies, vitamins, and certainly cannabis. We want to know about everything that the patient is taking. And so now the GI system, the gut and nutrition. Oh, so something to watch out for: constipation. Probably in my, the most common thing that we see in our clinic, right? Very important to manage because it can be a source of pain. And we want the goal of sort of 1 soft stool a day. And again, should be assessed every 6 months with the primary care provider. So reflux, again, sort of that stomach contents coming back up. And if anybody in the audience has had reflux, man, it is painful. It's just not something I ever want to have going on. And so if there's any concern that reflux is happening, just a trial of an acid blocking medication is really helpful. And chewing and swallowing ability should also be assessed regularly. Again, sort of worst case scenario is if we have food or liquid sort of getting into the lungs and causing an aspiration pneumonia, that's not good. So we want to really be assessing that. And if we need a swallow study to get a better idea, that's an important tool. And vitamin D, important, we know, because people with Rett syndrome have weaker bones, and we know vitamin D and calcium sort of work together to really maintain bone health. So that's something always to make sure we're supplementing and checking regularly in blood work. And so here is polyethylene glycol, which is also known as Miralax, something I just want to put on here because a very commonly used medication, again, to manage that constipation. So respiratory issues, concerns the lungs. So important to check for awake breath holding, hyperventilation, or fast breathing, or air swallowing. And this is an important point I want to bring up, sort of sensory regulation in our patients, right? Parents are excellent at knowing when there's something going on emotionally, when their children are feeling anxious or feeling overwhelmed, and often they'll breath hold or often they'll breathe quickly in those circumstances. So using that clinical sort of indicator to figure out what is the environment that's going to keep my child as regulated as possible, as calm as possible. Does that mean that when we walk into the primary care's office, we turn off those fluorescent lights because they're overwhelming, or trying to modify the school environment, right? So and if that means that here, if you have Elmo on the iPad to sort of keep your child regulated, that's fine, and also will help the primary care in being able to complete a full exam. And we also want to look for signs of disordered breathing at night. If we have any snoring or sort of longer pauses, a sleep study is definitely warranted. So neurology and rehabilitation medicine, again, screening for seizures or Rett spells every 6 months. And unfortunately, the difference between seizures and Rett spells is often very difficult to differentiate. The best neurologists have trouble. So a video EEG is the best way to really determine if there's seizure activity going on. And if it is safe, it also can be helpful for parents to capture that, on a cell phone, capture a video of what's going on. That can help in aiding the diagnosis. And if you are being seen, if your patient is being seen by a neurologist, really being checked in every 6 months if they're being treated for seizures. And a really important thing too is that, you know, if you have a weight that changes and a weight that changes more than 10 or 20%, and you have your patient is on an anticonvulsant or anti-seizure medication, you really want to let the neurologist know, because we want to make sure that the levels of that medication is going to provide control over those seizures. And you want to screen for abnormal movements yearly. These are sort of my hands in the corner here. So you know, hand stereotypies, right? The repetitive hand movements is the classic, you know, and if they're getting in the way of learning, or if there's self-harm because patients are biting, I mean, those are things to look at. And tone management referrals. So again, if anybody is, you know, getting tight, referral to a rehab clinician is helpful for a potential Botox injection to help with that. And then again, devices and appliance referrals, always important, right? The standard, you know, bracing, those things are important to always make sure we're on top of. And so cardiology, or, you know, the heart, again, the most important thing we're checking for is a prolonged QTC interval. And a QTC interval is a measurement on an EKG that is sort of assesses the electrical activity of the heart. And we want to make sure that that is not longer than it should be. And if it is, then we want to refer to a cardiologist if we notice that. So a yearly EKG is recommended. And why this is important is if a patient has a prolonged QTC, there are medicines that we know can worsen that problem, which can be dangerous. You know, very common medications, as you see here, azithromycin, a commonly used antibiotic, fluoxetine, Prozac, also something that we would consider in our patients. So something to just be really cautious of. So orthopedics and skin. So screening for scoliosis. I know this came up in the questions prior to the presentation. Screening for scoliosis every year or every 6 months if a curve is detected is important. And referral to an orthopedist if you have a progressive curve, so a curve that's changing quickly, or a curve that's greater than 20 degrees. Again, examining joints, making sure that they're moving well every year. Always being specific attention to hips, because we know that if the sort of the top of that thigh bone isn't in the right isn't in the right spot in that pelvis, it can be really painful. And we want to certainly, again, one of our broad goals is to eliminate our sources of pain as well as we can. And also, if you have a child or an individual that's bearing weight or walking, we don't want, you know, a painful hip to get in the way of that. So certainly an X-ray is an easy way to look for that. And you always want to consider bone breaks or fractures, right? So we know that bones in Rett syndrome are weaker. So that could always be an underlying source of pain. Stress fractures, again, things that we wouldn't always think about right away. And then you want to make sure that equipment fits, okay? So ill-fitting equipment, rubbing, pressure on skin can lead to this. This is a stage 1 pressure ulcer, and healing these, getting these to heal can be very difficult and take a long time. So trying to prevent them is the best way to manage. So if you take off a piece of equipment and you notice that a red spot persists for more than 20 minutes, that's something to be addressed right away, and really do not put on that piece of equipment again until it can be properly fitted. So development, education, and therapies. So tracking developmental milestones, a standard responsibility for a pediatric care provider, and also, again, a piece of, as the family, you work together to help track those at home, know when they're lost and when they're regained again. So, you know, individuals with Rett syndrome should have access to high quality therapy and the equipment and their families need, again, for example, like a stander. And also, it's important for the primary care provider to support the family in the IEP process. You know, often educators don't have experience with Rett, and they set inappropriate goals. And then if they don't meet those goals, then they lose therapy, or they set goals that are, that are sort of beneath our girls or our patients that we know they can do more. And again, just another plug, as previously mentioned, for those communication guidelines that rettsyndrome.org sponsored. They are just a great tool. So behavioral issues and sleep. So again, going back to my respiratory slide, trying to create an environment that allows our patients to be as regulated as possible. We know that, processing of sounds can be delayed. So again, this is a behavioral thing. They can be overwhelmed. So don't misinterpret that delay in response or action as not being interested or as being inattentive. And it might also be that the patient, again, is overwhelmed with the environment. So again, you're assessing for tolerance of bright lights, loud noises, sudden changes in position, sort of quickly putting a patient down to change a diaper can sometimes cause some anxiety and dysregulation. So I'm trying to limit these things. And you also want to assess for anxiety or depression. We know these things can be a concern for our patients, and the first thing I always try and stress is making sure that we're doing our best to maximize communication, because we know anyone who's really spent 15 minutes with these patients, they've got a lot. They have a lot going on and a lot to say, and the challenge is finding the ways that we can help them communicate that. You also want to assess for disrupted sleep. You can use medications, behavioral approaches to help getting to sleep and staying asleep. Certainly important for the patient, but also important for the family. So pain, again, sort of things that I've been discussing about this whole time. Assessing for source of pain is crucial, and this requires that head-to-toe assessment. We know that pain response can be diminished, so something that would seem very painful, sometimes you won't get that response from an individual with Rett. So parents, again, you're the best at knowing what's wrong, and often something is wrong, but not what is wrong. So again, working with you is crucial to sort of figure this out. And again, pain can also present not only as irritability or crying, which I think is the most common things that I see as parents report, but also emotional changes or sleep disruption. And again, we're thinking about constipation, we're thinking about reflux, we're thinking about position changes, hip pain, or we're thinking about a stress fracture that we may have missed. So endocrinology, gynecology, and urology, and I apologize if there are families or caregivers of male patients. Some of this won't pertain to you, but still important. So again, we're monitoring puberty development at those checkups, right? Sort of that Tanner staging, like I said. So adrenarche, the development of pubic hair, and tholarche, breast budding, these things can occur early in patients with Rett syndrome. Again, so something I'm always bringing up, so it doesn't incite panic if you see pubic hair earlier than you expect. And periods themselves usually start at a normal time or also can be delayed. And it's also important to consider suppression of menses with birth control, right? If periods are causing behavioral changes that are hard to manage, or you're seeing an increase in seizure activity, again, which birth control we use is sort of, we use on a case-to-case basis, case-by-case basis. The one that we don't recommend is Depo-Provera, the shot, just because we know that it can lead to further bone loss. And delayed bladder emptying, urinary tract infections, kidney stones. You want to be looking for these issues every year, and referral to urology if needed. And again, constipation, if we're chronically constipated, we have a higher chance of having a UTI. And so hospitalization concerns that are important. We want, we want a recent EKG of the heart. That's recommended before we do surgery, again, just to rule out that prolonged QTC interval. And individuals may take longer, may need lower doses of anesthesia, and may take longer to recover. Again, having an anesthesiologist that knows about Rett syndrome is important if you can manage that. And you want to ensure that the hospital team knows that these patients don't have a complete awareness of where they are in space, right? Sort of their proprioception is that term, and are at risk for falls. And also that they don't have hand use. So if they fall, they can't catch themselves. And they often can't change their position, right? So if we are in a hospital bed for a prolonged time, you can get those pressure ulcers that we've talked about. So just an important sort of example of where this was missed with one of our patients is they were recovering from surgery, and a nurse or one of the care team gave them what is called a PCA. It's a device that if you press the button, you're administered a dose of pain relieving medication. So again, not helpful. The patient couldn't press that button, and then we led to a period of time with some uncontrolled pain, right? So these things can have real consequences in how our patients are recovering. And so just general screenings, routine dental screenings, important because we know that dental decay and cavities can be a source of pain. No anesthesia at a dental office. If you are a patient of mine at my UCSF clinic, I'm always mentioning this. There is no safe situation where a patient with Rett syndrome is getting anesthesia, anywhere else than a major medical institution with an anesthesiologist. And so what that means is you may need to find a major medical institution that will do dental cleanings under anesthesia. And I know the access to this is not great. So booking things out, 6 months to a year in advance may be necessary with some travel. But getting the laughing gas at the dental office is just not safe. And then yearly eye exams, ideally with a practitioner who's knowledgeable in taking care of patients with special needs, looking for cortical visual impairment, which we know is something that can impact individuals with Rett syndrome, and apraxia. And again, why is that important? We know that the main form of communication is eye contact, is using an eye gaze machine like a Tobii. We just need to make sure that those eyes are working as well as possible. And family and social, certainly the last section, but not the least important by any means. Taking care of a special needs child is hard, financially, socially, and emotionally, and that needs to be recognized. And I'm always stressing the importance that caregivers get as many breaks as they can, go on a date, get in-home respite care. And I know that seems crazy to talk about during the COVID pandemic where no one can really do anything, but I just never want anyone to feel guilty for seeking that break, because maintaining your health and the health of your relationships is really important for your child too. And then connecting, as I know a lot of you do, with others on social media or through rettsyndrome.org is a good idea. And so unfortunately, there are some barriers to our patients receiving this care. Providers having and using these guidelines. We're doing our best, as mentioned, to disseminate these to as many groups and individuals as possible. And you can also help now with having the guidelines yourselves. Electronic medical records, again, sort of a blessing and a curse in some ways. We're trying to figure out a way to sort of integrate these into electronic medical records, but they can get in the way for sure. And again, duration of appointment time, as an experience of a primary care provider, we never seem to have enough time, and I don't think any medical provider or many professions can say they have enough time to get their work done, but that can certainly be a barrier. And then insurance reimbursement, right? And so your primary care provider advocating for you that these things are necessary to maintain the health of your child. And so here's just sort of some key takeaways, some pearls. So, it's important to ask your providers to do a complete exam for a checkup, right? If they leave parts out, you can ask them to complete it. That's totally appropriate. If you run out of time, ask to come back and finish an incomplete exam. Try and schedule a longer appointment slot in the future. And again, try and help your primary care provider by providing the guidelines and organized medical documentation, like I said, to sort of use their time wisely. And again, your child deserves this. They deserve this care. We really want to empower everybody to make sure that your child is as healthy as possible. And so I'm going to close with a video. This is my patient Allison and her mom Carla, and this is just a wonderful example of a little girl who is learning, playing, and really reaching her potential. and she's got a fantastic supportive family, and our team tries to take care of her as well as we can. And I also want you just to note, Carla is such a wonderful mom, and just notice, you know, how she's giving Allison time to play, to make her decisions, and playing a little bit of Mr. Potato Head with her eye gaze device. Again, so anyone who's not familiar, Allison is using her eyes to sort of settle on different buttons on the screen that will then talk out and respond to her mom, Carla. So let's see if this will work for us.
What else does Mr. Potato Head need? Mr. Bruce, that's the wrong place. No, it's not. That's where the eyes go. It's fun. It is. That's in the wrong place. It's not in the wrong place. This is the right place. Look, if we put it right here, that's the wrong place. That will look funny. To have eyes on the top of your head? It's so funny. But right here, it's time for a nose now. A nose? Now my knees and ears. Nose and ears, okay. It's time for a nose. No. Now my knees and ears. And this nose. It's time for a nose now. It's time for a nose now. You want the yellow one or the orange? Which one? You have to look at them. Look here. Hey, crazy bug. Which one? How does this look? The orange one or the yellow one? You have to look. Now I need some ears. Playing potato head. Me too, but now we need to pick. The orange one? Okay, nice.
So I hope you all enjoyed that. So I just wanted to thank everyone for your time, and here is my email address. So please reach out if you have any questions. I'll be more than happy to help.
Katie, thank you so very much for that incredible presentation, and especially for sharing that lovely video at the end. I think it really brings home the apraxia and the patience and the joy, and just a beautiful relationship between mom and daughter. And that relationship can extend to primary care physicians, educators, therapists who understand what are some common issues with Rett syndrome. So thank you so very much for that wonderful presentation. What I'd like to do is, before we move to QA, is invite Dr. Benke and Melissa Kennedy and Katie Hale to bring your webcams back on. And as those are coming back on, share with you a reminder that attached to the GoToWebinar dashboard are the references of the harmonized papers that rolled up into all of these guidelines. Also, these two articles are attached to the dashboard. And if you look into the comments field, you'll see that I also submitted the hyperlinks to those articles. And the guidelines are also attached. And a reminder, give us a few weeks and you'll receive the color copy in the mail, and we hope that you will share this broadly with your care teams. Okay, so we have a lot of questions in our queue, and what I would like to do is spend about the next, oh, we're doing great on time. Good job, you all. All right, we have over 30 minutes to go with QA. We have a lot of questions that were submitted at the time of registration that were answered in the presentation, so we'll revisit those if we have time. But we also have a lot of questions that came into the queue. So I am going to stop sharing my screen and let you all be big and large. And there we go. All right. And we'll do a round robin. So Dr. Benke, Katie, Melissa, if you want to take your first shot at answering a question, please do. And if anyone has additional comments to add on to a question, we have good time today. We have ample time for this, so thank you. All right. So first question that I'd like to start with, which I think was repeated a few times, is for from caregivers of either a young child or an adult with Rett syndrome, in addition to your primary care physician, what are the most common specialists that an individual should probably have on their team and regularly be seeing?
I can take a stab at that, Paige. I think one of the beautiful things about these guidelines is that, you know, in theory, it should keep, if this is done well by a primary care provider, you may not have to go to as many specialists, you know, which would be ideal, obviously. I would say, you know, probably most frequently is, you know, neurology. Someone like Dr. Benke is what we see. You know, gastrointestinal, a GI doctor, I think are the most common things, and probably an orthopedist. But again, you know, you have the primary care provider with you on your team can sort of work to manage a lot of these issues. And if you're proactive about that, then you maybe, you know, you can avoid going to a GI doctor, for example, if we're able to sort of really stay on top of that constipation, is just an example.
Great. Thank you, Katie. And Dr. Benke, as a neurologist and medical director of a Rett clinic, do you have anything to add?
No, I agree with that. I think to remember that your therapists are key parts of the team as well, and I think that they're irreplaceable. You could do without me, I think, a lot of the times, but you need a good therapist, but also rehab specialists too. And just to say to primary care providers that are hearing this or have interactions with the document, this is meant to be a living document. If somebody reads this and says, oh, well, that's bananas, we look for your feedback. We want these to be improved with the overall goal of, if we do this, we have a better outcome for individuals with Rett syndrome of all ages. I mean, that's the goal. I mean, maybe through this we'll determine, well, there's a minimum number of people that you really need. And what is that minimum number of people? Maybe we can figure that out.
Okay, thank you. But we also do hope that everyone will at least make one visit to one of our centers of excellence or specialty Rett clinics if they are in reach of where you live. I can't underscore the value of at least making one visit to visit with a Dr. Benke, a Katie Hale, or many of the other Rett centers across the US. Took a lot of their expertise to come up with these consensus guidelines, and for them to meet your child at least once is invaluable, and I say that as a parent. So thank you for letting me add my parent perspective. Okay, next question that I'd like to ask our panel is, so as our children age out of pediatrics and children's hospital care, what are the specific things that you would recommend in addition to taking the primary care guidelines with them to a new provider when they're looking for a new provider? What are the qualities that somebody with a child with Rett syndrome should look for?
I would say something, one word that kind of bundles a lot of the things that Katie was talking about, which is access. You want somebody who's available to see the older individual with Rett syndrome, and is, you know, oftentimes they're going to have an issue with, well, I haven't seen that before, I don't know anything about it. We want somebody that's able to be okay with that and be able to reach out to get help as needed. But I mean, the most important thing is we want people that will provide access so that your loved one can still be seen in clinic. And if you say, look, I have some concerns, and they'll get you into clinic and see you. I think that's what was the issue or essence of the question that was asked. Let's see what Katie wants to add to that.
Yeah, I think I agree with that. And I think just still with the understanding that that patients still have potential, even if they're older. I think it's unfortunate sometimes our older patients seem to be forgotten, and they shouldn't be. And so, you know, that's a key thing for all patients, but finding somebody who just takes the time and understands the needs, but also does their best to try and connect with your child, no matter what age they are, I think it's important.
It kind of related to one of the questions that I saw popped up. You know, I think that a lot of times, not just providers or physicians in general, but other members, you know, educators, everybody, they make assumptions based on what they're seeing the individual is able to do that don't take into account the cruelty of Rett syndrome that masks what they're really able to do. And I think somebody that's always going to talk to the individual with Rett syndrome is because they understand everything that you say. And I think that that's very important to finding providers that will look after the individual. You know, we recently saw an older individual, and she was in her 30s and didn't get access to an augmentative communication device until she was 30. And the family learned that she could read, that she could spell. And this opened up a whole new level of the relationship that the family was able to have with this individual, which was, you know, brings chills to you to realize that. And I think to continue to have a provider who's like, oh, well, let's try this. Let's you know, keep you active and doing things through your lifespan, I think is absolutely essential.
Hey, Tim, can I ask you a question? I know that you're based at a children's hospital, but how old would you say is your oldest patient? I mean, do you see patients with Rett syndrome well into adulthood?
I've seen patients older than myself. So, and I think that's part of our Rett clinic, which is difficult in some children's hospitals, just with it's not the providers necessarily, it's just the licensing around the hospital. But when we set things up in our partnership with Rocky Mountain Rett Association, we said we want to see individuals of all ages. And so that's part of our charter. And while we can see them as outpatients, it makes it a little difficult to see them as inpatients because of those issues with how the facility is licensed to operate. But I think that, you know, finding providers who are willing to do that, and most of us in our centers of excellence are able to see individuals throughout the lifespan, and we look forward to it. We call it Old Ladies Day in clinic, and it's a fun time.
Thanks. Excellent question, Melissa. And I think that you'll find that pretty consistently across all of the clinics in the country, that as a Rett center, they will see patients of all ages. And yes, I've had the pleasure also of meeting women who are older than myself. So be careful with that use of the old ladies club, please.
I'm old, Paige.
We don't have to share, we don't have to disclose our birth dates on this. And, but I can tell you it is a joy and a pleasure to meet some women who are older than myself, who are still walking and social and doing really well. I hope that for those of you who visit a clinic, that you have the opportunity not just to get the expert advice from the care providers, but also the wisdom of meeting other families. It's really a joy to meet families of kids of all ages at the centers of excellence, which is another benefit beyond the care that you get, is the socialization you get with meeting other families. And by attending our Ascend Summit in 2022 in Nashville. Okay, so I'll stop that plug and move on to our next question. So we have a wide spectrum of people attending our presentation today, not just clinicians, not just caregivers. We have school nurses, we have grandparents, and we have some adult siblings who are asking how they can contribute to the care of the child with Rett syndrome, as well as therapists and you talked a little bit about therapists. Can you talk about the benefits of really having as many eyes on our kids as possible and how they can use these guidelines to help, given whatever their perspective is, grandparent, school nurse, etc.?
Well, the first plug I will say is when COVID's over, for all those adult children, give your parents time to go on a date. let your mom go out for a walk, right? Giving some time to those primary caregivers is important. I think, I mean, again, the team, multiple eyes, having just that team mentality with, I love that there are school nurses on this call. That warms my heart. It's wonderful. But what I think is really important is not only are you having these individuals sort of looking out for things and sort of being familiar with what, again, is needed medically for these patients is a great idea. But I also think that just building those relationships with individuals, right? I was just on a call with a family on Friday, and there's an older sister who comes in to see her younger sister who's got Rett syndrome, and she only will smile in pictures with her older sister. And like she refuses to smile unless her older sister is there. So, I don't ever want to underestimate truly the value of those social connections for our patients, because again, as Tim said, sort of being aware and being an emotional person and a being that can't express those things easily, I think that can be extremely beneficial. That's my thought.
Just to add, I think that the conversations that I have with school nurses are essential for my neurology piece, which is teasing out seizures and spells. I think that depending on where you're at, that might be your primary care provider. It's so difficult to tease these apart, but it's the school nurse that's key, because the child's in school, they're having a spell, they're trying to decide, do I need to keep this child here? Do I need to keep this individual in the care home today? Do I need to call 911? What is my action plan? School nurses, they need their action plans. They're about action, and I get it. And we need to help them with those as much as we can. And I think that's part of our role. It's also part of the primary care provider's role in making sure that school nurses have those sorts of things in place, because when COVID will get better, and we will be back in school and we'll get back to those usual relationships. But being in school is hugely important for providing therapies and socialization, and school nurses are part of that.
Thank you for those comments. We have a couple of questions. One is on Rett spells and seizures. So that's a little bit of a deeper dive, and I'm going to hold that one because you did mention it, Dr. Benke. But I want to go to what you ended on, which is therapies. And we know that it's different across the country at this time, what's being delivered via telehealth, what's not being delivered at all. And for some places in the US and around the world, kids are back in therapy clinics. So not a question specific to the time of COVID, but I find this question is asked all the time. In the guidelines, do you have got recommendations for the frequency of therapies, the types of therapies, and what the dosing of those therapies should be across the age span? And we know that insurance, payment, all of those complicate the issue, but let's say in normal times, is there advice in the guidelines about what therapies should be done and how frequently?
Katie's deferring to me on that one. This is a fantastic question that we don't know the answer to, because my personal opinion is I want you to have high quality therapy for an hour with speech, OT, physical therapy, your augmentative communications therapist, swim therapy, and hippotherapy every day. And oh yeah, I want you to get an hour of good socialization in there too. But that's my opinion, but I have no proof that will improve things. I think they will. But this is one of the aspects of the primary care guidelines, and also what we want to do with our centers of excellence is to try to answer that question for you, because there's a lot of payers that want to know the answer to that question so that they can have guidelines as to how much they're going to pay for it. And I think a lot of individuals will get something daily in school, but it's the quality of it as well that is hugely important. You know, I think, you know, it could be that once a week of high quality therapy is sufficient, but I don't know the answer to that. But I think that access to these therapies is, personally, I think one of the biggest barriers of finding somebody who knows how an augmentative communication device, knows that they exist, knows how to use them, knows how to reach out to somebody who has experience with Rett syndrome to say, you know, well, you need to give her a little bit more time. Don't put 24 choices on a page to start with. Those sorts of things are all key. So I think it's an access question as well as a frequency question that we want to try to address. That's a great question.
Okay, thank you. Thank you very much. And if we find that therapies are being discontinued because the provider or therapist is reporting a lack of progress, can you talk a little bit about how you as a center of excellence, as a Rett clinic, can help guide families to prevent that from happening?
Unfortunately, it happens too often, and we have to remind providers and therapists that it's not necessarily about gaining skills, because that's how therapy is set up. You break your leg in a car accident, you regain your ability to walk. It's about maintaining skills. And so, you know, Katie and I, one of the things we do is we'll write letters of medical necessity to remind therapists that this is what the goal of therapy is, so that they can adjust those goals to understand them. Now, you know, a lot of the insurance providers, that's not how they think about things, and we have to do our best sometimes to remind folks that that's the issue. I mean, the other related issue is that, you know, the way things are set up with schools is that you are magically better when you turn 18 or 21, depending on your school district, and these sorts of things need to continue throughout life. And it's one of the things that we try to address in the guidelines, to say that, you know, meaningful interactions and therapies need to continue forever,
And
regardless of progress.
yeah, I agree. I agree with Tim. And I think, you know, one thing, if you can, and this is something I always stress sort of with my newly diagnosed families, is trying to really right off the bat establish appropriate goals, right? So I don't want anything in the record as, oh, she didn't meet X, Y, and Z, so now, right, like showing failure, that's not a good place to start. So really, again, speaking to what Tim said, sort of trying to work, you know, with the Rett Center, with a Rett Center of Excellence, right, using those communication guidelines to really set appropriate goals to begin with, so we aren't going back and fighting, you know, which again can just take months to get things restarted because of, you know, the system that we're functioning in, unfortunately.
Great, thank you. Okay, we have a lot of questions. Oh, I'm sorry, Melissa.
No, I just want to add one quick comment, because I can't obviously, you know, comment on any of the clinical aspect of this, but I think from an advocacy perspective, something that's really important to know when you're thinking about the work of our foundation is, as we organize the clinical network, we are able to work with brilliant clinicians who can help us evaluate the impact of therapies, and ultimately as well medications on quality of life, and, you know, measure that and evaluate it in a way that's objective and at a national level, and can use that information to have meaningful conversations with public and private payers, and try to influence payment at a national level. That's something that when you organize around a network in this way, and you're an organization with an advocacy initiative or an advocacy focus, that's something that you're able to do. It's longer term. It's not helping in the day-to-day right now, but certainly it's critical work and work that this clinic network is committed to.
Great. Thank you, Melissa. That's incredibly important. And it reminds me to mention something that I put into the comments field, which is many of the experts have done past Rett eds with us that go specifically into what should be the goals in therapy, or issues on sleep, issues on movement disorder, deeper dives on epilepsy versus Rett spells. And we invite you to continuously visit our website to look at those deeper dive recordings for specific issues, especially we have a lot of questions on digestion and GI issues, and we have some wonderful Rett eds on those. So if we don't get to those questions today, visit those recordings, and also keep informing us of what your questions are. As Melissa said, we are committed to renewing these guidelines every few years based on the consensus of our experts. But if we don't know how they're serving you or not serving you, we can't improve them. So thank you. Melissa, we've got a question from our community about translating these guidelines. Can we say that we have them available, and if there are other associations in other countries that we work collaboratively around the world, or do we have, I'm saying that as a colleague to you, I'll stop and let you answer.
Well, I believe that we are embarking upon a Spanish translation. Paige, I think that you're actually in the middle of that, so you probably can answer that a little more honestly than I can. Clearly, if there are other associations that are interested in working with us to translate, we're happy to have that conversation. But we've initially focused on Spanish translation because that's just critical.
Yeah, thank you. And yes, we are in the process of translating these for Latin Spanish, and those will be becoming available, and we'll let you know when they are available. Dr. Benke, can you comment though on how these guidelines, you mentioned at the beginning, but I think it's worth repeating, if the guidelines are based on US medical care practices, or do they take into account worldwide consensus thinking?
So that's a good question. One of the things that came about through the process of publishing these, and these are published in the British Medical Journal of Pediatrics, is the reviewers wanted us to comment and tweak on the published versions to make sure that they were not just speaking to US-based healthcare. So in general, they do encompass that. We were aware of the UK guidelines when we were writing the paper, and we were very intentional about making sure that what we were providing was something that was, it's going to be, Rett syndrome is the same there as it is here, but they were speaking to the way that we were approaching things in terms of what is the evidence for particular symptoms existing, and also how do you break it into different stages of life, which is how they're published. It's not necessarily how the guidelines are that you're sent off of rettsyndrome.org, because that's more of a working document. But when we published it, it was very conscious of the different stages of life, and that is really how the American Academy of Pediatrics puts their guidelines out. And so we were putting things in that sort of context when we wrote them, so that they will appear different in that regard, at least in the published form, to what's seen in the UK guidelines. I would say that there has been some people in France that have reached out since they were published, and no, I couldn't translate for them this into French, but I know that those groups are, at least some families and some providers there are aware of the guidelines, because I've passed them off to them.
Okay, thank you. It is definitely, Rett syndrome knows no bounds. It does affect people equally around the world, and I'm so proud that we're able to support families around the world with the guidelines. Thank you for all the work on these. We have about 10 minutes left. We have a lot of questions that are very specific to symptom management, and we also have a lot of research questions. So again, I'd like to remind folks that they can visit our website and look at a lot of Rett Ed recordings specifically about the current state of research and on deeper symptom management. But over the course of this presentation, people have downloaded and are looking at the guidelines and have a few questions specifically related, and I feel like we should take those first for our last few minutes. Now, one of our attendees has asked the question about head circumference and measurement. They see that as a recommendation in the guideline. Can you explain why that's important and how that might inform care?
Great question. So one of the recent papers that came out of the natural history study looked at head measurements and how they're related to severity. And a lot of people come in and they're saying, here's my genetic report. What does it mean? Do your best to try to predict the future. And I think that head circumference measurements are probably one of those better pieces of information necessarily than your specific genetic change that might provide some of those counseling points when we talk to families about severity. There's still a wide range. There's still a lot of other pieces of information that are used. I don't think that our prognostication is that good yet, but I think that head measurements are likely to be one of those pieces of information that we use going forward when we have those discussions.
Okay, thank you. And we have our first questions for your next iteration of the guidelines, which is looking at the area of gynecological care. And if there's a place where people can find more information, or if you will do some more consideration in the next version for this big stage of life for our teens.
We'll keep that in mind as we learn more, and certainly look forward to input from primary care providers in that realm. As we said before, this is a living document, and we look forward to that input coming in. So thank you.
Yeah, I'm hopeful that, that over time we'll really start to get a better understanding of, birth control and menstrual suppression and what is the best thing to use. If we can come up with something standard, I think that would be helpful, because that question often comes up a lot. And I'm talking to gynecologists a lot who, are needing counsel on what we recommend. So I'm hopeful that's an area that we'll really be able to flesh out more in the future.
Thank you very much. And Katie, you spoke about what's in the guidelines currently, that those exams are important, and bring in specialists if there are concerns. Don't gloss over them, and respect that your child is aging and needs to be looked at for issues of womanhood and manhood, and both of our populations. We also do have a Rett Ed recording on puberty and adulthood that was done by another nurse practitioner, Jane Lane, out of Alabama, and she gives us some deeper guidance. So please, for those parents asking about adulthood issues, take a look at that Rett Ed, okay? And let us know if you still have questions. Okay, we have a lot of questions about behavior and anxiety. And I think given where we are in time, that I'm seeing more and more families come to our foundation and asking about a lot of emerging anxiety in our children who have been housebound due to COVID. But in general, behavior and anxiety are issues that we see in Rett syndrome. Would you mind, in the interest of acknowledging where we are in time, talking a little bit about what you would do for these kids who have high behaviors and high anxiety, either pre-pandemic or emerging because of the change in their social environments.
Well, yeah. So I'll just quickly say, again, just sort of tying some of the pieces that I discussed, right? I mean, behavioral change, the first thing you always want to think about is pain. If there's something going on that's resulting in pain that's then reacting, again, we know that just pain response can vary, right? And, trying your best just to maximize communication, and I know I already said that, but I sort of say that over and over again. And, that's obviously these individuals are social, and we know that they're missing out on seeing, if they're in a whatever classroom environment, seeing their therapist, right? The Zoom, this isn't good enough for any of us really. It's giving a little bit, but, so I think just focusing on those things as best as you can, with the understanding that, we're certainly limited with what's happening right now.
And Dr. Benke, do you have anything to add?
No, sounds like we need a red ad on that.
Okay. We'll be finding an expert. We certainly do. I hear that, and we will take that into consideration for our 2021 calendar and moving forward. Okay. Another question that we're frequently asked is about assessing intelligence in our children. So you talked a lot in the guidelines about the use of communication guidelines and communication devices. Is there guidance on assessing intelligence?
So one of the issues with all of the standard measures require somebody who either uses their hands or is verbal. So we do not have a measure that does this. Now some of the measures folks have tried on a research basis to use a communication device to try to probe this a little bit more. But I think this is one of the things that we can emphasize over and over again, is that you cannot assess intelligence, and so assume that they understand everything that you are saying and telling them. Look, we all know our women with individuals with Rett syndrome, they start rolling their eyes at their mothers on time. 9 years old, they're rolling their eyes at their mothers, okay? So we know that they're thinking the things that a 9-year-old girl would think. So I think your care team, just you model that to them, that they're understanding everything, and hopefully they'll pick up on those cues that they understand everything, because they do.
And this is really important because, if you're beginning the IEP process, right, sort of you usually, at least in California, there's a form that's given, like, sort of preparing for the upcoming assessment, right? And sort of just saying, yep, that's fine, sign off on it and go, then we know that these traditional assessments might be applied, which again will completely be useless and sort of undervalue what we know our kids can do. So, I always counsel families, check that box that says, I want to have this, but I need to discuss it with you on what is recommended, right? And to make sure, in addition, that, this is going to take additional time, right? Care of these patients takes additional time, not only for the apraxia that we know, sort of the delay in response, but really trying to get things done quickly does not usually go well. And unfortunately, we're in a system that, things need to be on time, but just stressing the importance of that, of the examiner observing the kid, how they are with their TOBI, observing how they are with their family, and really, again, partnering with the family to get a sense of what they're capable of, because as parents, I mean, you're with them. So just making sure that is taken into, very much into consideration.
Great, thank you. Well, we are nearing the end of our time together. So I want to let you know that there have been a flurry of thank yous and gratitude and expressions of excitement about these care guidelines expressed from the community. So we cannot thank you enough for the information that you have spent so many years distilling for those of us who don't have a medical background to facilitate our ability to work with providers and really get to the nut of what people should be looking for in Rett syndrome. And I really hope from the comments that we're hearing from clinicians, primary care providers, school nurses, therapists, who are so grateful to have these guidelines as well. We bow down to all of you. Thank you. Thank you for your time. Do you have any closing thoughts to share with us before we wrap up for the day?
I'd just like to quickly, Paige, thank Tim and Katie for their dedication. And there's a whole team of folks behind both of them that support their work. And I want to thank them and just acknowledge that it's really, our honor as a foundation to be able to support this work, and are grateful that it's helpful.
Yes, and I just, stress again that that our patients and your family members, they deserve this care, and it's a team effort, and we're all here to help as much as we can.
Thank you.
Stay well. Check out the COVID blog on RSO.
Okay. If you do have any closing thoughts on vaccine and COVID, I know you mentioned it earlier. We have quite a few questions in the queue, and maybe we can close on that note before I go into my closing slides. Thoughts on vaccines in our children, whether they are 6 years old or 60 years old with Rett syndrome. Do you recommend?
When they become available to that particular age range, they should get the vaccine.
Okay. Parents and caregivers?
Absolutely. This is, I think, the key to us getting back to some sense of normalcy is getting everybody vaccinated.
Okay, great. Thanks. So until then, wash your hands, wear your masks. Let's all be safe. We look forward to having you with us again for future Rett Ed topics. You each have expertise in your area and are just so committed to our community, and for that we are grateful. So thank you for being with us today. Thank you for taking such precious time out of your very, very busy schedules. And we know it's been a long year for you as healthcare providers. And we are just wish you the best. We wish you the ability to stay restored and refreshed in your work and in your life so that you can continue to serve our community. Thank you so much. Melissa, thank you for taking the time to be with us today. We know that you have a lot of work ahead of you for our foundation, and we invite everybody to sign up for our newsletters, follow us on social media, visit our website to see all of the exciting updates that are coming out in the field of research and in care, and virtual meetings until we can be together again in person. Last plug, in Nashville, 2022, April. Okay, so this concludes our Rett Ed today. I hope our attendees found such incredible use. I hope this was a good use of your time. Please download the attachments. If you had any trouble downloading attachments, don't hesitate to email me, and they will also be posted, or they are posted, to our website. Okay, we look forward to seeing you next month on March 9th for communication guidelines, talking to some real people who have been applying it in the time of COVID through telehealth and in schools and in centers. I think you'll find that really valuable to see how people have taken those communication guidelines and applied them in real life to benefit their children. And to all of our caregivers, to everybody, our children are worth our every effort to overcome the challenges before them, and it is a team effort with our clinicians, our foundation, you as families, every advocate. Take this information that you learned today, apply it, share it with others. We've covered a lot. Do me a favor, we're going to hit you with a little survey as you log off of this website or off of the Rett Ed, and you can tell us what you'd like to see for future Rett Ed topics. And we really do take those into consideration as we build out our calendar. So please, it's not just your normal marketing survey. We want to know what you want to hear. Thank you very much. You all have a wonderful afternoon or evening, depending on where you are on the globe. And we will talk to you again next month on March 9th. Thank you. Bye-bye.